Hi, good morning, everyone. My name is Sophia. So I'll start off with the news back in 2022. As a young female athlete, pro-Australian rule footballer, died at the age of 28. So autopsy was done and noted that there's accumulation of tau protein in her brain. She was the first female athlete to die of chronic traumatic encephalopathy. So today we'll dive in deeper for chronic traumatic encephalopathy, or known as CTE. So CTE is a progressive neurodegenerative disorder that linked to repeated head trauma, including concussion and subconcussion impact. So commonly seen in contact sport, and also people who repeatedly bang their head, for example, those in mental disabled or military. Okay, so the pathophysiology of CTE is caused by, like I said earlier on, repeated head trauma, leading to a cascade of neurodegenerative changes. So firstly, there will be axonal sharing and inflammation. The impact causes a microscopic damage to the neuron, disrupting the brain communication. So this will trigger chronic inflammation and lead to progressive brain injury. So this inflammation and brain injury will lead to abnormal tau protein buildup, which it will spread and kill the healthy brain cell, leading to brain atrophy. So the tau protein usually will accumulate at the frontal and also temporal lobe, and then eventually will lead to brain degeneration, in which the brain will shrink, and this resemble like Alzheimer's disease. So who are at risk of CTE? There are athlete and non-athlete. First, the athlete are, like I said earlier on, are the contact sports athlete. They are the rugby athlete, footballers, American footballers. The footballers usually those uses heading a lot, martial art, boxers, or those in extreme sports activities like BMX or bike or skateboarders, where they are prone to fall. And then the risk increases as the athletes started the contact sport at early age. And then those non-athlete examples, the military, which are involved in blast injuries, or those with mental disable, which they headbang a lot, or epilepsy, or patients that are under domestic violence, which they are domestic violence. So the classification for CTE are based on Dr. N. McKee and Boston University CTE Center. There are four pathological stages for CTE. First, stage 1 is the mildest form. Neuropathology is when there's a minimal tau protein accumulation in the frontal lobe. So the symptom will be mild headache, subtle mood change, mild concentration, and memory difficulties. It's often asymptomatic and mistaken as stress-related issue. And stage 2, mild to moderate. There's an increase in tau protein deposit in the frontal lobe, progressing to amygdala and hippocampus. So symptom will be depression, anxiety, noticeable memory lapse, and also increase in impulsivity and also aggressiveness. Stage 3 is moderate to severe. There will be widespread tau deposit in the frontal, temporal, insular cortex, and there will be sign of neurodegenerative. There will be symptom of severe memory impairment, or like early dementia, paranoia or suicidal tendency, speech difficulties, and slow movement. So patients at this stage are often diagnosed with Alzheimer or misdiagnosed with Alzheimer or frontal temporal dementia. And lastly, the stage 4 end stage is when there's an extensive brain atrophy and severe tau protein deposit, including the brainstem. So there will be a severe cognitive improvement and full-blown dementia. It will affect their speech. There will be dysarthria or dysphagia, and motor dysfunction, slow movement. There will be rigidity or ataxia, tremor, and also they will have gait problem. There will be shuffling gait for this patient, and they lost independence and require full-time care. So how to diagnose CTE? So current challenges for CTE is there is no reliable biomarkers or imaging to diagnose CTE up till this date. the only way to diagnose CTE is by postmortem or autopsy of the brain to look for the tau protein accumulation. However, now they are doing studies and research for biomarkers and also for imaging for early detection of CTE. It's still ongoing. So what we can use is clinical diagnosis approach to diagnose CTE. First, by comprehensive history, asking their past concussion or repetitive head trauma history, and then ask for any behavioral, mood, or cognitive symptom pattern on that patient. And then we can do neurological testing by using the Montreal Cognitive Assessment to look for mild cognitive impairment for the patient, and also psychiatric evaluation for the patient to assess the depression, impulsivity, or aggressiveness. So treatment for CTE. CTE is irreversible, so treatment only focuses on symptoms relief. So we can tackle the cognitive impairment, their mood and behavioral management, and also their motor dysfunction. So this, what we can do is giving them medication. For example, in cognitive, we can give a cholinesterase inhibitor, which is also used in Alzheimer for memory loss, or NMDA receptor antagonist for cognitive function. And then we can do cognitive therapy or brain training, like memory and brain training exercises. And then lifestyle change in that patient, for example, diet change, which is diet high in antioxidant or omega-3, and also encourage aerobic exercise to promote brain plasticity. For mood and behavioral management, we can give, for antidepressant, we can give SSRI or norepinephrine dopamine reuptake inhibitor for motivation. We can give them psychotherapy or cognitive behavioral therapy to control the impulsiveness, anxiety, or emotional regulation. As for motor dysfunction, if they have Parkinsonism-like symptom, you can give dopaminergic drug and also physical therapy to improve their mobility and also gait. And social support and family education are really important for patients with CTE. And lastly, for prevention, besides the medical and lifestyle management for the patient, another thing is it's important to increase awareness among the athlete, the coaches, as well as the family member for the athlete. So first, we can educate them on reducing the head trauma. For example, while training, we can advise them to limit full contact practices. For example, in rugby, tackling reform for the patient, or reduce heading in youth soccer. We can also advise the coach to ensure the athlete had a proper concussion recovery after, if say the athlete had a concussion. And also we can advise them for strict return to play protocol or policy. So the key take-home message is CTE is a progressive neurodegenerative disease, occurs over the years of decades after repeated head trauma. The early symptom is mostly behavioral or mood related. So for example, the impulsiveness, the depression, and it can often misdiagnosed as PTSD or depression or other mental health issue. And well, the late symptoms are usually cognitive decline and motor dysfunction. These can often misdiagnosed as Parkinson or Alzheimer or ALS. There is no definitive diagnosis yet, but there's a research ongoing for the early detection for CTE, and prevention is the best strategy for CTE. Thank you.